Right in. We going right in. All right, hey y'all, come on in. Come on in. Come on in. I got Dr. Buckles here. Nobody's here yet, but they'll be coming in. Let's see. I'm gonna share it. You're gonna like, tag, and share. We'll put that in there.
I got it.
Got it.
Yeah, what do you just share this to?
Yeah, just share it from there. We on Facebook Live and YouTube Live at the same time.
Okay. Got you.
Right, I'm gonna type this in.
What do you just share this to?
Yeah, just share it on Facebook Live.
Got you.
All right, Bonnie Sanders is here. Hey, sister, there they go. They coming on in. Hey there. All right, they coming on in. I see y'all. I see y'all coming on in. I see y'all coming in. There you go. There you go. We got Dr. Buckles here tonight, so they coming to hear the doctor. I've been on break, but the doctor called and I had to cut it short because we got an emergency update. Listen, make sure y'all love this. Tag it and share it. We got an emergency update. Tag, share. Let everybody know we got an emergency update for you. Y'all come on in. Come on in. Come on in. Grab a friend. Praise the Lord. Good evening. This is an impromptu. We got some folk here tonight. Hey, Doc, look here. The Zetas are here, Doc. The Zetas are here.
Oh, wow.
Rats. There you go. Y'all come on. Invite them to tell all the rest of the Zetas. Y'all come on. We got a COVID talk tonight. We got a COVID talk on tonight. Y'all come on in here. Come on in here. So we are so blessed and privileged to have as one of the elders on our staff, one of the members of our APC family. Now he's an official virtual member of the Greater New Virtual APC. And there are so many others of you out there. Listen, I'm going to say it like this. There's just 25 of you right now, but they'll come back and watch this in the replay. Listen, I want you to join us, join the APC family. Once you subscribe, you have just become part of the family. Look at that. How about that? You just became a member, just like that. Just subscribe, and you're already there. You're part of the Greater New Virtual APC family. So, without further ado, on tonight, we've got our resident doctor. We've got Dr. Buckles with us on tonight. I'm going to dive out the way. I'm going to let him get right into talking about COVID vaccine. Everybody wants to know about the vaccine. Everybody wants to know about the vaccine. Where you're going to hear it right here from the doctor. And then I'll come back. We'll close out with some Q&A and do that kind of thing. So I'm going to bring to you, he needs no introduction. He's internationally known, nationally recognized, and locally accepted. Dr. Anthony L. Buckles.
Thank you, Pastor Bill. So I'm trying to get to my slides here. And you can see this, right, Pastor Bill?
Yes, sir. Yes,
okay.
Sir.
I'm going to start my show here. Hey, hello, everybody. I'm just coming out of the emergency room, and I'm so glad that my pastor, Pastor Bill, asked me to talk about the vaccine tonight. Pastor Bill, can you still see the slides? COVID-19 vaccine?
Oh, where we go? Yes, sir. It's up there, right there.
Okay,
yes,
very
sir.
good. Everybody know me. I'm Dr. Buckles. I'm emergency room medicine and family medicine. And I enjoy what I do. Tonight, we're going to talk about the COVID-19 vaccine. Just a real short introduction so you'll know about this. And the immune system. I want to first talk about the immune system because if you understand the immune system, some things about it that you can understand what the vaccine does. So whenever a person gets affected with the virus, it may take several days or weeks for your body to make and use all the germ-fighting tools needed to get over the infection. That's why we tell people, take 14 days to quarantine yourself because it will take some time for you to really get over the infection. But after the infection, though, your immune system remembers what it's learned about how to protect the body against that disease. And so there are two types of cells that I want to talk about tonight. They're called T lymphocytes and B lymphocytes. The T lymphocyte cells are what we call memory cells. And they go into action quickly if the body encounters the same virus again. And it's these T cells that recognize infected cells and kills them. Well, there are also something called the B lymphocytes that produces antibodies to attack them. So these B cells release these antibodies that attaches to the virus. When the virus comes back into your body, it binds the virus cannot enter into the cell. So these are, you don't remember anything tonight, remember T and B cells. The T cells attacks the body, evade the outside the cells, the B cells, and then the T cells tackle when they get affected. Okay, so this is a great PowerPoint right here that shows you on two sides. You see the side where you see the little virus up there, and you see on the side where the virus has gone on where the green circle at down there in that pink little cell right there. That pink cell is effective. You see the viruses are inside that cell, that red virus. So this is a T cell. It goes and it finds an affected cell and it kills that affected cell so it won't affect the other cells. On the other side, you see the blue circle right there. That is a B cell, okay? And you see the B cells making those little antibodies, those little blue wishbone looking structures. And you see how it attaches to those red viruses there. And once it attaches to the virus cannot enter into those cells at the bottom. You see that big old X mark there? It shows you. So these two cells, the T cells, okay, that kills affected cells already, and then the B cells, which make antibodies in our bodies. So it's all about your T cells and your B cells, your T cells and your B cells. And so what the COVID-19 vaccine does, it helps our body develop immunity to the virus. Okay, listen, the vaccine does not or will not keep you from getting a virus. Not the vaccine. The vaccine helps your body fight. Okay, so it can help you to protect yourself from getting super affected or protect yourself from getting sick from the virus. So it's all about your immune system. Okay, so with like all type of vaccines, the body is left with a supply of memory T lymphocytes as well as B lymphocytes. They remember to how to fight the virus in the future. It typically takes a few weeks for the body to produce these, okay? So once you get the vaccine, it still will take you time for the body to produce the T lymphocytes and your B lymphocytes. That's why we tell you still to wear your mask, still to practice social distance. I have people say all the time, why do I get the vaccine if I'm not protected right away? Well, that's not the point of the vaccine. The vaccines helps your body learn how to remember or to fight off, to produce these antibodies so you can fight out when it do come. But it takes a few weeks for it to happen, okay? Therefore, it's possible that a person can be affected with the virus, okay, right after they get the vaccine and get sick, okay? But does not mean the vaccine has not done its job. The vaccine will do its job, okay? Because it's going to help your body. And sometime after the vaccination, your body will build immunity, start building immunity. And that is what we see with the symptoms. Why people get the fever, the chills. I had a doctor friend of mine who worked with me yesterday who took the vaccine yesterday, the second dose. And he went home last night, lay down, and about 10 o'clock last night, he started getting fever and chills, and he just didn't feel well all night long. Today, he feels a little better. But that was the response of his immune system to the vaccine. Now, there are three main types. So we're going to talk about these vaccines tonight, and then we pass will have a discussion. There are three main types of COVID-19 vaccines. And you don't know, and you're not going to see all three, okay? In America, we're doing the mRNA vaccines, okay? mRNA, what does it stand for? Messenger RNA. And this vaccine contains material from the viruses that cause COVID-19 that gives our cells instructions on how to make a harmless protein that is unique to the virus. So the vaccine has some piece of the virus, okay, structure of the virus. And when we give you the vaccine, it causes your own cells to make this harmless protein that is unique to the virus. What does your body do? Your body sees the protein, okay, and it starts building up, it starts recruiting T lymphocytes. It starts building up B lymphocytes. So when the real virus do come, your body has already these memory cells and these antibody cells that were able to fight the virus. Same thing. So that's one type. Another type is called protein subunit vaccines. And that's when they even actually take a harmless piece of the virus, and instead of the entire germ, okay? And once vaccinated, our immune system recognizes it. So you actually take a piece of the virus itself and you put it into the body. We're not doing this, okay? But this also will cause us to make immunity cells. And then the last thing is called a vector vaccine. The vector vaccine, which I don't think we'll ever do in America, is when you actually take a weakened version of another live virus, then you put another virus and you put the genetic material from the virus that causes COVID-19, you insert it into that virus. That's why I call it vector virus. And then you put that into the body, and then it makes your body respond. So in America right now, what we're doing the mRNA. This is called messenger RNA viruses. These viruses, this vaccine teaches our own cells how to make a protein, okay? And this protein is what triggers our immune response in our body, okay? So we put this vaccine in. The vaccine tells our body to make proteins. They almost resemble the coronavirus or the parts of the coronavirus, and that is what triggers our immune response, okay? If our immune response is triggered, what happens? We start producing antibodies, okay? So that when a real virus enters our body, the antibodies are produced. Now, this vaccine give instructions to our cells to make a harmless piece of what is called the spike protein. Now, you know why it's called spike protein, right? Because on the coronavirus is what? The coronavirus is aligned with what? Spikes. That's why it's called coronavirus. Corona, a crown, okay? And so these spike proteins looks like what's on the surface of the coronavirus. So when the coronavirus or COVID-19 virus do come in, the body sees these spikes and say, wow, I've seen these spikes before. And let me attack these spikes, or let me bind to these spikes, okay? So our body is actually doing the work, not the vaccine. The vaccine is triggering our body in order to make protein that will have spikes on it, these spike proteins that should not be in our bodies, and then it causes our body to make these T lymphocytes and B lymphocytes, okay? So that's very important. So I tell people this. People say, well, can you still get sick if you get the vaccine? Yeah, you still get sick, but your body responds faster. You get the flu vaccine, you might still get the flu, some sort of the flu, okay? But I'd say like this, Pastor Bill, if a person was robbing your neighborhood and if we didn't know who the person was, they would come in your house, sit on your couch, check you out, and come back and rob you crazy, okay? But what if we took pictures of the robber and sent pictures to all the neighbors and sent a picture to your house? You still might get robbed, right? The robber still might come into your house, but guess what though? You know how the robber look like. You have a picture of the robber. And so you're able to fight fast. You're able to pull out your gun and get your knives and call the police faster, okay? That's what a vaccine does. When we give a vaccine to a person, it's a picture, okay? Or it causes a picture to be made where our body can respond. So when the real coronavirus do come, our body is able to respond faster. So this is why people ask me questions, well, why this vaccine was formed so fast? Well, traditional vaccines, old vaccines, are very effective, but they are very time consuming. Most of our old vaccines start out with a live version of the virus, like the flu vaccine, okay? We take a live version of the virus, we had to kill the virus and activate the virus and then inject it into your body, okay? So we had to grow the virus, make it safe to be injected into your body, which takes a long time. For example, people don't realize this, that the flu virus every year takes over 6 months to make. That's why, and we have to make it every year because the flu virus itself changes its dynamics or its shapes every year. The flu virus is very smart. So the flu virus of this year will not look like the flu virus of next year. That's why the vaccine don't work, okay? But we take the vaccine, we kind of like think, scientists looks at the structure of the flu, what they think it might look like, and they grow that vaccine. It takes over 6 months to make. They take the flu vaccine or viruses, grow it in a lab, they put it in chicken eggs, and then they harvest the virus, they kill the virus, and then they purify the virus. And then they give this to you through the clinic and to the pharmacist, okay? So it takes about 6 months to make the flu vaccine every year. Okay, so when you get it in September or get it in October, trust me, they've been growing this flu virus, this vaccine, making this vaccine ever since probably January or February of the year. Okay, so The flu shot is just the vaccine that has been grown, or just the virus itself that has been grown in a lab, okay? It's been killed, harvested, killed, inactivated, and then injected into people for protection. So how does the mRNA work? It's a little different because now this is not a live vaccine, okay? It's just a messenger piece. We take a piece of the messenger, the spike protein, okay? Your body then makes this protein in your body, the cell that looks like the spike part. So once inside the cell, then your body begins to make the antibodies, okay? They produce the viral proteins, make the antibodies. So when the COVID-19 virus do come, okay, your body has already made these antibodies and the T lymphocytes that can kill the vaccine. So I don't know if you noticed or not, but mRNA vaccines are not new. What we did to make the COVID-19 virus is not new. So I hate people talk about, well, this is something new, or how come it was made so fast? We've been doing mRNA vaccines for decades, okay? We have used it, we have studied with the flu, with the Zika virus, with rabies, with cytomegalovirus. We've been using it in cancer research. We've been using mRNA to trigger the immune system to help target specific cancer cells, help treat cancer patients. So this mRNA method is not new. And this method, it really is more faster than traditional vaccine methods. Mainly because we're not giving you a live virus or an inactive virus. We're just using the messenger RNA to trigger your body to make its own proteins, its own antibodies, and make its own T lymphocyte cells after you are vaccinated. So your own body, your own cells is what builds up the virus proteins, which are a foreign part of the body, which trigger your immune system. So there's some facts about the COVID-19 mRNA vaccine. First thing is that mRNA vaccines, you cannot give someone COVID-19 because you got the vaccine, okay? Because we're not giving you the virus, okay? mRNA vaccines do not use live virus that causes COVID-19. We are using this is genetic information, this is genome, this is genetic that we are using about the virus to make your own body produce these foreign proteins to kick in your immune system, okay? Number two, these mRNA virus vaccine does not affect your DNA in any way. It's not DNA genetic material, okay? This ribosome nucleic acid, okay? Messenger. The cells, so when the cells uses mRNA, the cells then will break down and get rid of the mRNA soon after it's finished using the instructions, okay? So the mRNA is just instructions. That's all it is. Instructions given to your own cell to make these spike proteins. It looks like Corona-19 virus, so your body then can start making antibodies and T lymphocytes against COVID-19. And there are two mRNA vaccines that we're using now: Pfizer, the BioNTech, and the Mrna. I just got my second dose of Mrna, but 2 days ago, I had a little soreness in my shot, but I had no other symptoms, okay? So I've had my first dose, and I've had my second dose. Both of these vaccines requires 2 doses to be effective. Now, how do we compare? Now, looking at these vaccines, I want to look at these real fast. When comparing vaccines, I want to compare it to the flu and also to the MMR vaccine. Most of you have got MMR vaccine. This is your measles, your mumps, and your rubella vaccines. And you know what? I hear people say, well, I don't know vaccine that have 2 shots. Are you crazy? You don't have vaccine that had 5 shots. You remember you had the Hib vaccine at age, you was 15 months old. I mean, you probably was 12, then you was 15 months, then you was 18 months, 2 years, and then 4 years. You had 5 of the Hibs. The tetanus is 2 shots. Remember? Matter of fact, the tetanus is more than 2 shots. Forget the DTaP, which is diphtheria, tetanus, and the pertussis. You get those during your young years, and then you get another booster when you get 10 years old or you get in high school. So you had 5 or 6 of those. So there are many of our vaccines that you get multiple shots with. Some shots is the first shot, and you get boosters. I mean, I don't know too many, that you just get 1 shot. even hepatitis B. Hepatitis B is what? It's 3 shots. You get 3 shots. 1 month, a month later, and then what? It's like 6 months later. That's 3 shots. So stop saying about, well, this vaccine got 2 shots. What you all be used to that by now. So look at the Pfizer, look at the Moderna. These are types. What types are these? These are RNA virus genetic code. These are not live viruses. You get 2 injections for the Pfizer, 21 days apart. Moderna is 4 weeks apart, okay? The Pfizer is about 90%, Moderna about 95% effective, okay? The big difference between these two also is that the Moderna, you can store it at a higher temperature, and it can last up. It can be kept up to 6 months. The Pfizer is very hard to keep. It got to be kept in a very cold environment, and so a lot of places, because of the amount of vaccine that you got to get out at one time, a lot of places are using now the Moderna. The Pfizer is very hard to keep and does not last. Once you thaw it, you got to give it. And once you thaw it, you cannot waste it. Okay. The flu vaccine. And look at the flu vaccine. You get this every year. And the flu vaccine actually is a virus that we have inactivated. So we actually give you the flu virus that we have inactivated. Okay. It's an annual injection. And how effective is it? 40 to 60%. So even if you get the flu vaccine, you got 60% of you might not get the flu. You got 40% that you might get the flu. So that's why people still get the flu when they get the flu vaccine. And look at the Mrna vaccine. This is a live virus. We actually give you a live virus and put it into your body. 2 injections at least 20 days apart. And it has 97% effective. You look at Pfizer versus Moderna. Once again, this one was a journal, one of the nurse article journal. The main things that look at the cost of them, look at the effectiveness of them, and look at both of these. None is not. They only approved for what Pfizer was 16 years and older, and then Moderna 18 years old. So we don't have no vaccines for people who are 12 years old or people who are young, okay, or infants, the young age. So 16 and age 18, and both of these are 2 doses apart. And last thing I want to talk before me and Pastor Bill ask questions is that once again, the vaccine is not really is what's going to kill the virus. It's your own immune system. We give these mRNA, these codes, is put into your body so your body can your body cells can make these spike proteins. Where the body say, wait a minute, these spike proteins don't be in the system in your body. And so your body start making these antibodies and these T lymphocytes and maybe B lymphocytes. And so if you do get the COVID-19 virus a couple of weeks later, your body's already seen those spike proteins and now it can attack it faster. And so you might not even get any symptoms, but if you do get it, it might not last but a couple, about an hour, day, or 1 or 2 days, and you're done. Your body's fighting off. So once again, what's most important for this season, y'all? I've been preaching this all the time. As African Americans, we got to improve our immune system. You got to get your immune system a boost. That's why I put all my patients on vitamin D. All my patients are taking vitamin C. And we got to start eating stuff. You don't get this stuff from eating McDonald's all the time. You don't get this stuff from eating all this fast food. During this season, if it don't teach you anything else, you got to learn how to eat better and get these things. Because you need the zinc, you need the vitamin C. These are vitamins that help with the antioxidants and help boost our immune system. These are very important vitamins. Vitamin E, vitamin B6, vitamin A, iron. And so you see the type of food that we should be eating. That's why we are doing injustice when we go to the grocery stores and load out carts of all this fast food stuff and all this frozen stuff, and we're not taking out time to buy things that our kids need to have a immune system, because as we get in ages and we as humans grow older, we have more diseases, more COVID. COVID-19 is not going nowhere. There's going to be other coronavirus coming, okay? It's not going nowhere. We got to do is learn how to build our immune system so when other virus comes, what God has given us, our immune system, okay, is what's going to help us on this this journey. So, Pastor Bill, that is a list of lesson plan about the virus. I will stop sharing. I'm coming back to open this back up. I think I'll open this back up to Pastor Bill.
Doc,
Yes.
that was wonderful. I commented that you just gave us a great science class. And I know you can't hear all the people clapping for you, but they're clapping and they're celebrating because they're grateful that you're here. Some of the comments we've dropped, they're in. Since we're on Facebook and YouTube, you can, whatever, see some of them, and we'll post of them, but all of them will be there in the playback. However, Doc, here we go. I'm going to dive right here. There is one question, and I'm going to dive right here with this first question. It says right here, if you have antibodies, should you take the vaccine?
That's a question I'm getting from everybody. So listen, if you are making antibodies already, okay, then I don't, personally myself, if you take the vaccine, you just give yourself an extra boost, okay? So there are some people who are making antibodies. Listen, now I've been around COVID since it started, and I check myself for antibodies so often. I've not made antibodies yet, naturally, but I bet you if I check my antibodies next week or 2 weeks from now, 3 weeks from now, I bet you won't have antibodies. You know why? I took the vaccine. So everybody is not going to make antibodies. Okay, I've been trying to make antibodies. I've been trying to get my IgGs. I have not had no IgGs for 8-9 months. But if I check myself a month from now, I bet you I'll be making IgGs because I took my vaccine. So you got to pray about that. I know that's a good question. If you already make antibodies, then some people say, well, why? So you might not need a vaccine, but it's a booster. It will make sure you really start making those vaccines.
Okay, so to be clear, and I just want to recap one thing you said for the people like me that sat in the back of the class. I'm going to help them out. You're saying that the way the vaccine works and the reason why you are suggesting that people get the vaccine is because the vaccine is going to help reinforce or fortify your immune system.
Yes.
So that your immune system will be able to help your body do what it needs to do to fight against the virus once the virus invades your body.
Man, you get an A, Pastor Bill. That's an A on that question. You understand exactly what's going on. Because the vaccine itself does not fight the virus. It's your own immune system.
So yes, I'm grateful to have wonderful people like you in my network and village. And my wife is an amazing educator. And she has been definitely making sure that I stay safe because she said to me very clearly, I'm a science teacher, don't you? I said, yes. She said, I might not be a doctor, but I understand viruses and how they work. And so, Doc, here we go very clearly. Who would you suggest to not take the virus? Or the vaccine. I'm sorry, the vaccine.
So this is one thing here. If you have side effects from vaccines, okay, you have to be very careful, especially if you had allergic reactions already. Some people cannot take the flu vaccine or take certain vaccines because they had severe reactions. Angioedema of the face, okay, swelling, throat closing, stuff like that. Then those people would not take the virus. Also, if you had, what a lot of people are getting sick, I believe, is that a lot of people are walking around asymptomatic with COVID-19. So we had one nurse who got real sick for a week because she did not realize she had the virus. She took the vaccine, and a day later, she got sick as a dog.
Wow.
Okay? So think about this. If you got the virus in your body already, okay, and you don't know it, and you stick some more virus-like material in so your body's already starting want to fight it, okay? And you stick a vaccine in your body gonna be like double fighting. So you're gonna feel terrible, okay? So that's why we tell people, if you had the COVID-19 virus, if you had the virus, okay, wait 90 days to get the vaccine, because you might cause more harm if you get the vaccine before then.
Got it. Y'all got that? Everybody, are you clear? If you've had COVID-19, make sure that it has been 90 days.
3 months. Yes.
3 months. All right. Since you tested negative, make sure that it has been 3 months, and then you should get the vaccine.
Yes. For 3 months since you had the COVID-19. So
yes, 3 months since you should take a test, and it should show that you are negative, meaning that you no longer have COVID-19. And then 90 days later, you should still get the vaccine, even though you had COVID-19. Yes. COVID-19, Doc, can tell you by confirmation, is a repeat offender, isn't it?
It's a repeat offender. People are getting, there are people now, we're seeing people who had it, got well, came back, had it the second time. It's a repeat offender, yes.
So also too, someone asked, what if you have underlying conditions, if you have comorbid conditions, should you still take the vaccine?
Well, that's a good point. There are, if you have comorbid condition like diabetes, hypertension, stuff like that, yes, because your immune system is jacked. Y'all won't believe it, but if you got hypertension, your immune system is jacked already. I mean, I ain't say it's jack, but can you imagine most black people got metabolic syndrome, right, Pastor Bill? What's metabolic syndrome? Diabetes, hypertension, high cholesterol. Those three. Metabolic syndrome. That's a lot of African Americans. I just start practicing in Mississippi, and most of my patients automatically know they got diabetes, hypertension, and high cholesterol. Most of them got that. It's amazing. I can pull up my charts and you'll see that. Okay, so your immune system is already jacked, and then don't be smoking cigarettes and be a little wine taster every day. I'm just saying, you know what I'm saying? That also, I won't say wine, but all the other stuff that people drink. Wine is probably better for you than anything else. But and then you drink all these Cokes and Pepsi all day long. Guess what you have done? Your immune system. Okay, you eat the wrong type of food. You know what I'm saying? When we are obese, when we walk around and we're supposed to be 180 pounds and we 280 pounds. Guess what? Your immune system. That's why your knees hurt and you have arthritis and you don't feel good. Why? It's our immune system. So, but now listen, if you got autoimmune disease where your body is always attacking itself, you know what I'm saying? You might want to just think about that, okay, about the vaccines. But once again, the main thing is that if you had an allergic reaction to the vaccines in the past, you might ask your doctor first about the suggestion of getting this vaccine.
All right, so there you go. Consult your primary care physician above all.
Yes.
Right. There's some questions in here. I think we can answer that. If you don't, when you go to get the vaccine, or if you're thinking about getting the vaccine, then get a COVID test on site. They now have rapid tests regularly available. Stay tuned, stay connected to APC Morgan Park, because we have been having testing and we will continue and reconvene with testing, and we are working on vaccination as well. So you make sure you do it right now. Don't tarry, don't delay. Subscribe to the APC YouTube page. Go ahead, Doc.
And Pastor Bill, if you got a cold and you don't feel good, and especially if you can't taste and smell, you got a headache, don't go out there and get the vaccine. Wait, because you could have COVID, and you can make it worse if you go get the vaccine.
Wow, man. Well, Doc, you have definitely given us something wonderful to hold on to, something to think about, something to share with all of our people. I'm not going to hold you any longer, Doc. We can get to talking all day, but here's what I want you to do. I want you to post what's your Cash App, Dr. Buckles?
It is $. Bill, why you asking me that?
All right. Somebody get Dr. Buckles' Cash App.
Right now.
All right. There you go.
It is My Cash App, Doctor, is Doc. Oh yeah, I knew it. So it's $ Doc Buckles 8. So $DOC as in Doc Buckles BUCKLES 8.
8, the number 8.
Anthony. The
Oh,
letter
A. Okay. A as in Anthony. All right.
Yeah.
Listen,
So,
I want you all, since Dr. Buckles took his time out to sit with us and share with us. Oh, there we go. COVID testing. We got COVID testing at church Wednesday.
wonderful.
Coming up next Wednesday, 10:30 a.m. to 2 p.m.
Wonderful.
Somebody, they said we need to pin it. Oh, we need to pin it. I don't have time to pin it, but we get it pinned. How about that? Somebody pin it for me. If you're out there, somebody pin it. I definitely posted it. But Doc Buckles A, $ Doc Buckles A. I want y'all to send Doc an offering, not because Doc needs the money, but if anybody that knows Doc will probably take the money and buy the emergency room staff lunch or something, or he's going to send it to his missionary cohorts out there on the field, or whatever have you. Doc, do you want to give any shout outs there before we go?
Well, Pastor Bill, I just thank you, man. I love you, man. You are my boy. Y'all, what a wonderful pastor. He's like the Issachar tribe. He's in tune with what's going on in today's time. He knows the time. You know what I'm saying? And this is the time that we have to educate our people. We got to get past just shouting and jumping. And while we're going to live on the earth, y'all, we got to get the body right. And you know what I'm saying? So continue on walking, continue on losing weight, continue on eating right, build your immune system, because it's your immune system that makes the difference. Not all this medicine. It's your own immune system that makes the difference.
Doc, I got one more question before you go. Here we go. So what I want to ask you to speak both by permission of the spirit and by profession of trade. But right now, we're still under a pandemic, correct? Right. And it seems as though things are loosening up and lightening up and restrictions are being lifted and people are moving, and now you can get a vaccine, and now there's contact tracing and you still wash your hands and still wear your mask after all that's said and done. But we do know that there has been a variant strain that has been reintroduced.
Yes.
Can you speak to the potential possibility that maybe this strain could mutate and we could close this year out, or later on this year experience another massive outbreak of maybe COVID 19.2?
And you know what? You sound like a prophet, Pastor Bill, because that's what I was discussing one day with some of my colleagues that it could be a COVID 21 or COVID 22. You know, COVID 19 is only named 19 because it happened because we found it in 19.
Wow.
But that COVID 19, I believe, probably was around. And these viruses they're smart. You know, viruses they need live vectors. So this mutation, and remember, COVID-19 is not going nowhere, y'all. It's a pandemic, but once we control it, it will become an epidemic, like the flu. Okay, pandemic means worldwide. Once we control it, it will become an epidemic. So every year when you go get your flu vaccine, you're gonna get a COVID vaccine.
Wow.
And the ERs when we test you when we test you for the flu, guess what? We test you for the COVID. We may find better ways to test you for the COVID. But the COVID is going to become part of, now COVID has become part of our standard treatment in the ER when you come in with cold, headaches, flu-like symptoms. So it's not going nowhere. But Pastor Bill, you're exactly right. I'm afraid that if we don't change our ways, and the best way to protect us in the future from these attacks, we got to get better in our health. America, Pastor Bill, we're the most richest country in the world, but we're the worst country when it comes to preventive health.
Wow.
We spend billions of dollars after we got diabetes, after we got high blood pressure, after we on dialysis, after we almost blind, after we almost lost our legs, after we don't have massive heart attacks, and then we spend billions of dollars afterwards. We don't pay attention to prevention health. Before we, so can you imagine, Pastor Bill? I wish I had known how to prevent myself from gaining weight when I was 12 and 13. Nobody told us how to not gain weight. They just fed us. Go eat, boy.
That's right. Get fat.
What to eat? They told us go eat. Did they fix fried chicken? They fix whatever. They put it in front of us and said, eat, or else you're going to starve. And
eat all your food, too. Yes, sir. Eat all your food.
You know what I'm saying? We normally had 4 servings every meal.
Mm-hmm.
I mean, that's normal for black people. You know what I'm saying? We get a big helping of rice and gravy, 2 or 3 pieces of chicken, a piece of cornbread, a big old helping of greens, and that was one meal. They said eat. Nobody thought about preventing us from getting fat, overweight, diabetes. And everybody in the family got diabetes, and nobody thought about preventing the young people from getting diabetes.
No, sir. No, sir. Man. Well, Doc, listen, like I said, Doc, this is always great to have you because you always give us what we need, tell us what we need to hear. Again, I can't say thank you enough.
Thank you.
Saints, I will say it to you like this. Stay saved and stay safe. How about that? Right? So we thank you for the good information that you've given us on tonight, Dr. Buckles. Saints, eat right, protect yourselves, keep yourselves in the love of the Lord. Stay tuned next month. We're coming back. We got to close out this month. Dr. Buckles is going to the ER. I'm going to finish. I've been praying and trying to get before the Lord because the year is closing. I mean, we've gone into a new year, but we've got to fight through this pandemic that we are still yet under. So we want to make sure that as the year progresses to a close, that we are making sure that we are spiritually sound and we are wholly healthy. So again, Dr. Buckles, thank you on tonight. You have a good night. We'll be praying for you. Everybody, listen, I'm going to let you go on tonight. Make sure you go to the APC website. Make sure you subscribe to the APC YouTube page. And stay tuned next month, February. We're going to have an awesome time. TNT Live is coming back. It's Black History Month. And we're going to be talking about Black church history on next month. We've got wonderful guests, Dr. David Daniels. We've got Dr. Eric Williams will be with us on next month. You don't want to miss it. Make sure you invite somebody. We're going to be talking about Black church history. I'm Bill Ellis. I love everybody. I'm out. I'll see you later.